As of January 2025, the HIV positivity rate for this age group in Njoro sub-county was 0.6%, higher than that of Nakuru County, which recorded a rate of 0.4%. Of my speech, especially to direct to you young people, we really love you, and we are ready to listen to you. We are ready to go to the table together, dialogue together, get to understand one another, so that we can go forward in our county. So today I have witnessed a potentially transformative youth-friendly center. I have observed the potential for specialized health services for young people at the Njoro Sub-County Hospital due to the establishment of this center. Njoro Sub-County serves a catchment population of 280,897 individuals, with 33% of individuals aged between 10 to 24 years. This population accesses services from our health facilities, of which 219 are public and operated by the Nakuru County government. 24 of these public facilities are located in Njoro sub-county. Our facilities offer outpatient services, including a specialized clinic at Njoro sub-county hospital, alongside inpatient care. Additionally, the health facilities within the sub-county provide laboratory services, maternity care, child welfare clinics, family planning, and a comprehensive care center and youth-friendly services. This Youth Empowerment Center has the potential to tackle the multiple challenges that prevent the youth from thriving. Currently, Nakuru's teenage pregnancy rate stands at 13%, significantly lower than that of Njoro sub-county. However, this figure has decreased from 36% in 2022 to 17% as of January 2025. In Njoro sub-county, the teenage pregnancy rates are recorded as follows: Mauche Ward at 21%, Mount Narok Ward at 20%, Naswit Ward at 19%, Kihingo Ward at 15%, Lare Ward at 11%, and Njoro Ward at 13%. Family planning uptake among individuals aged 10 to 19 currently stands at 20%, compared to the county average of 45%. As of January 2025, the HIV positivity rate for this age group in Njoro sub-county was 0.6%, higher than that of Nakuru County, which recorded a rate of 0.4%. We hope that by creating a youth-friendly area within the hospital, we can positively influence health-seeking behavior. In this space, young people will feel safe, welcome, and supported. This is our aspiration for the youth. Given the significant youth population, which includes those attending higher education institutions such as the Rift Valley Institute of Science and Technology, Egerton University, Njoro Polytechnic, and Njoro Vocational Center, we remain hopeful that this center will enhance access to and encourage the utilization of adolescent sexual and reproductive health services. We shall continue to develop interventions like these to ensure our youth feel included and valued. I would like to take this opportunity to express my gratitude, along with that of Governor Susan Kihiga, to our incredibly versatile and enduring partners, DSW, now YSW, along with AMREF and others such as you said, to Chenge Jamii, for their support throughout this journey. We assure you of our highest esteem and promise accountability and good stewardship regarding these and other investments. Your investment is not in vain. I'm pleased to know that the center has been collaboratively developed with the Department of Health in general, and specifically with the Njoro sub-county team and the management of this hospital. This provides me and hopefully you with reassurance of sustainability. I would also like to express my gratitude to all our strategic partners, including representatives from the national government, religious leaders, the Ministry of Education, and the Ministry of Social Services. The faces of young people represent our past, present, and future. We are all collectively responsible for nurturing, protecting, and supporting our youth. Let us continue working together to empower them for the future. Thank you very much, and may God bless you all. Asanteni sana.
Kwa majina naitwa Daktari Daniel Wenaina, mimi ni mkurugenzi wa huduma za matibabu katika kaunti ya Nakuru. Leo hii tuko hapa Njoro katika hospitali yetu ya sub-county ambapo tunazindua kituo cha vijana ama Youth Empowerment Center. Kituo hiki kimefanywa na kati ya county government ya Nakuru tukishirikiana na wahisani na wafadhili wetu YSW na DSW. Na kituo hiki kimeletwa hapa hususan kwa sababu ya kuangalia mambo ya wellness ya vijana. Tukiangalia katika zile takwimu zetu, Njoro sub-county ni ya pili kwa wingi wa idadi ya watu katika kaunti ya Nakuru, ambapo iko na wakaaji 280,080, karibu 300,000 ya wakaaji. Kati ya hao asilimia 33, a third of that ni vijana kati ya miaka 10 hadi miaka 20. Na hao ndio tunalenga katika kuzindua kituo hiki ili waweze kuja kupata huduma ambazo zinahusu counseling, zinahusu mambo ya kuzuia magonjwa kama ya zinaa, magonjwa ya ukimwi, zinahusu pia mambo ya jinsia, gender based violence. Na tukiangalia sababu moja ya kuanzia Njoro, kwa sababu hii ni mwanzo tu, tunanuia kuweka vituo kama hivi katika sub-county zote, ni kwamba tukiangalia takwimu kuhusu mimba za mapema ama early pregnancy katika Njoro iko juu kidogo kushinda the county average. Tukiangalia katika ward zetu, ward ambayo inaongoza ni ward ya Mauche ambapo teenage pregnancy rate is about 21%, ikifuatwa na ward ya Mau ambayo ni around 20%. Ward ya Kihingo about 19%, Lare at around 11%, na hapa ambapo tuko Njoro around 10%. Na tunataka kulenga our youth ili waweze kuwa na information to make decisions, ili kuavoid mambo ya early pregnancy, kuavoid mambo ya madawa kama na mihadarati, na pia kuwaempower katika masomo. Ukiangalia kituo hiki kiko na vitabu, kiko na computers, kitakuwa na internet ili waweze kupata information ambayo inaweza kuwa empower. Tumeweka nurses katika kituo hiki, who are young nurses who are friendly to our youth, ili waweze kupeana counseling na pia general life advice. Na tunaomba vijana wetu kutoka Njoro na hata maeneo ya sub-county ambazo ziko karibu hapa kama Rungai, Molo na kwingineko waweze kuja kutumia kituo hiki. Nikimalizia ni kwamba tuko na vituo vingine ambavyo viko karibu kukamilika. Katika sub-county ya Njoro tunaangalia eneo la Lare ambapo ni mbali kidogo na hapa. Tuna pia Molo ambayo tunanuia kuanzisha kituo kama hiki, Naivasha, pale Nakuru mjini na hata Gilgil. Na nafurahi sana kwa sababu our partners DSW na YSW wameweza pia kusupport vituo vingine pale Gilgil na eneo la Naivasha. So nafikiri kwa hayo tunashukuru pia sana kwa sababu serikali yetu ya Nakuru ambayo inaongozwa na gavana wetu Susan Kihika imeangazia sana masuala ya youth, si kwa health peke yake ila pia empowerment. Na mlisikia hapo awali kwamba pia kuna mipango ya kufund purchase of equipment kwa wale wanatoka katika polytechnic zetu. na hata through KCB kuna fund ambayo youth wetu wanaweza kufaidika wanapokuja kwetu kupitia kwa sub-county administrators. Kwa hivyo serikali hii imeweka mkazo sana kwa mambo ya youth kwa sababu ndio future yetu kama county ya Nakuru. Kama nilivyosema, hii ni ya kwanza, lakini tuko na zingine 6 ambazo zimeanza, lakini tunanuia kwamba at the end of the day tutakuwa na centers in every sub-county, na county hii ya Njoro kwa sababu ya ukubwa wake already tuko na hii ya kwanza na pia Lare pale maeneo ya Lare ward. Ukiangalia Njoro is largely a rural farming community. When you look at the Maunarok and Mauche ward, we have a number of large farms where our young people sometimes drop out of school to go engage in farming activities, and this contributes to early pregnancies. And once early pregnancy comes with a lot of other social challenges, where a child begets a child, and that child is not able to grow very well, is not able to have good nutritional support, is not able to go to school well, and the vicious cycle continues. But also we have the urban centers where there are different socio-economic challenges, and all these contribute to the challenges we talked about. Njoro also has a number of institutions of higher learning, the largest being Egerton University, where there's a lot of youth population. We have the TTIs, like the Njoro TTI. We also have the polytechnics. And generally, because the second largest in terms of population, then we expect a large population of the youth. And with these comes a lot of challenges. One of the challenges we've not talked about is the issue of suicide. We've noted a rise since the COVID times when there were a lot of disruptions and a lot of penetration of social media, where there's a lot of pressure for the youth. And one of the things that this center is going to do is to offer counseling for all those youths who have challenges. They are invited to come here where they'll find counselors that are youth themselves, and they're able to help them to chart their way and to guide them in life and life skills.
By the partners, Nutrition International, YSW and DSW, and by ourselves, let me give you an assurance. This is a co-created initiative. We have walked the journey together with DSW from the beginning. We have had a team here. In fact, Your Excellency, if you will recall, in August 2024, Her Excellency, the Governor plus yourself, officiated at the signing of a rapid results initiative on development projects. We in the Department of Health, NI, DSW, and YSW need to hear this. We decided to include this project in Her Excellency the Governor's RRI. And so every week we were requested, because you've spoken about monitoring and evaluation, every week we were expected by the Efficiency Monitoring Unit to report about it. And so even some of the hoops that we had to, there are some bumps along the road, as usually there are. We were required to manage them together with DSW, and we did, and we are here now. So it's a collaborative effort. So in case we are thinking, because I've seen a lot of noise about donor-funded programs, I want to assure all of us that everything that Her Excellency the Governor and the DG commit themselves to doing with partners is embedded in the DNA of the government. So rest assured. Secondly, Your Excellency DG, Evelyn introduced two of the staff, one who's working in Gilgil and 2 who are working here. I want to specifically talk about Melissa, and I'll never stop speaking about Melissa. Because I'm often in this hospital, Daktari knows it. I'm the deputy med sup in charge of infection prevention. That's my job. So I've often come here. She's a nurse by training. Melissa, please stand up. She's embedded here by DSW. She's a nurse by training. I've often come to this hospital, Your Excellency, and found her in the maternity. I've often come here to this hospital and found her in the maternal and child health department, working alongside the rest of the staff here. So I want to thank you for that. Because for us here, it is integrated services. Unfortunately, we did not get an opportunity to visit Dr. Cherano's hospital.
Excellency, the Deputy Governor, Madam CEC, DSW, YSW, Mr. Kimemia, and all officers present, Vijana, Everybody here, good afternoon. Thank you for this opportunity. My name is Emily Onchari. I work for the Kenya National Library, the Nakuru Preservation and Conservation Facility. They have said that they are going to advise you, but as the library, we want you to get the facts through the books. And that is why we have provided the books. Thank you.
Thank you so much, and thank you for your partnership.
Our guest of honor, His Excellency, the Deputy Governor, allow me to ride on the previously placed protocols. Good afternoon. We, as National Syndemic Diseases Control Council, cannot be happier to see such an initiative taken by Nakuru County. For the youth, please make sure you make maximum use of this facility. It has taken a lot to come up with such, and let us not let it go to waste. I'm also welcoming you. We have a Maisha Youth Initiative at the National Syndemic Diseases Control Council. I'm welcoming you to join, and you can help each other make better futures for yourselves. Thank you.
Thank you, Madam Wasiri. Your Excellency, our Deputy Governor, all protocols observed. Good afternoon. For me, I would want to really appreciate the coming up of this institution, because we have all that we need to give to the young people, both from prevention to treatment and more so promotive health for the young people. And so in reproductive health, it's so much about information, giving the youth to understand themselves. We know the young people, the teen to up to 24 years. These are ages when the young people are trying to find their path in life. And so this center is really going to give us room to give them that information, to understand their bodies, to understand what is happening, and also to draw their path through individualized counseling. For the young people who may find themselves already involved in what have been talked here, either drug abuse, teenage pregnancy, I want to tell them that it is not the end of the road. You can still make it in life. You can rewind and start your life again and move forward to achieve your potentials. Thank you.